Did you know that Medicare can be confusing? Did you even know that it is confusing? Even though the alphabet is something, the ABCs is something that we learn very, very early on, Medicare and all of its alphabets can be confusing. And that's why the Center for Medicare and Medicaid Services actually requires that to sell certain Medicare products, insurance professionals like myself, who have been doing this for a good number of years, and even if you're just starting, have to have classes that we must do every year. So every year we must do a process that's called certification. And then the next year, after the first time, it's recertification. That recertification is to actually be certain that we are aware of changes in laws, changes in processes, changes in the way Medicare is delivered, changes in what Medicare covers and what Medicare doesn't cover. So as an insurance professional, I am here today to just talk to you about the very, very basics of Medicare. This is not going to be a 2-hour, 2-day, 3-day class. It's just an overview of what Medicare is. How do you get Medicare? When should you think about Social Security? And if you have questions, I'd like to answer those questions when I'm done giving you those fundamentals. If you have questions, you can also contact me. My name is Faye Horton. My website is Faye Saxon Horton. You can go there and book a 30-minute complimentary call where we can discuss anything about Medicare that you'd like to discuss. And there are no fees for the services that I provide for you. So first of all, who's eligible for Medicare? Who actually can have Medicare? People who are age 65 and older, who have worked and paid into the Medicare system for 10 quarters, or you have a spouse who has worked and paid into the Medicare system for 10 quarters, you then will have Medicare Part A without any cost to you. Medicare Part B, of course, does have a cost, and that's determined annually, every year. That's determined by the Center for Medicare and Medicaid Services. I'm going to refer to the Center for Medicare and Medicaid Services as CMS from this point on, so that you know who I'm talking about. Those are the people, that is the Department of Health and Human Services that actually oversees everything that goes on with Medicare. So if you're age 65 or older, you may be eligible for Medicare. If you're under 65 and have certain disabilities and you've received Social Security disability payments for 24 months or 2 years, you also qualify for Medicare. And then if you have end-stage renal disease or Lou Gehrig's disease, you can qualify for Medicare that way as well. So those are the people who are going to have Medicare. If you don't fit one of those, but one of those situations is coming up, then you know that you're soon going to be eligible for Medicare. That's the first piece. There is absolutely no sense in you learning about Medicare or knowing what Medicare does unless, of course, you're going to be eligible for Medicare. So let's talk now about those alphabets. Part A of Medicare, and most times you're going to get a Medicare card. It's called the red, white, and blue cards in some places. It's called your Medicare card, and everybody recognizes it. It looks very similar to voting cards, but it is distinctively different. It will have your name, it will have your MBI, which is your Medicare beneficiary identification. And that is no longer your social security number. So if you have a Medicare card and it has your social security number, that number has been changed and you need to contact Medicare to get a new card. Part A of Medicare covers hospital insurance, and hospital insurance would be for inpatient hospital stays, rehabilitation facilities, x-rays while you're in the hospital, surgeries and radiation treatment while you are an inpatient. It also covers skilled nursing facilities, hospice, and home health care. And most people, because you have worked or your spouse has worked and paid into the Social Security, those are those taxes that come out of your check when you're working. Most people will not pay a premium for Part A. Part B, B for boy, is for medical treatment. And Part B will cover all of your outpatient services. Those services would include home health care, ambulance, doctor's office visits, x-rays outside of the hospital, laboratory tests, therapies, any outside of the hospital services, medical services that are approved, of course, by Medicare. Now, with Part A and Part B, many people feel like, well, I'm going to be eligible for Medicare in 3 months. So I know I'll get my red, white, and blue card and I'll be all set. I'll have health insurance and I won't have to pay. Fallacy. Not fact at all. With original Medicare Part A and Part B, you will have deductibles and you will have coinsurance. So there are a few benefits within Medicare, original Medicare, for which you won't have out-of-pocket cost. However, when you're using the services of original Medicare, you will have out-of-pocket costs for other expenses. So you will have deductibles and coinsurance, and those amounts have no cap. So it's possible that you can use just your red, white, and blue card for services, but remember that your out-of-pocket cost is not capped. There's no limit to what you might have to spend out of pocket. So the other option here is to add what's called a Medicare supplement, or you may have heard of it as a Medigap plan, GAP. So the Medicare supplement or the Medigap plan picks up the gaps, those deductibles and coinsurance that original Medicare approves but doesn't pay. So now you're paying a premium monthly to an insurance company, and it doesn't matter which insurance company you choose, it's your choice. All of the Medicare supplement plans are going to offer the same supplemental coverage. Now, here's where there are a lot of alphabets. They go all the way to K and L. So if you are recently turning 65 or turning 65 or getting Medicare soon, most often you're going to be offered a plan G, G for good, or N for Nancy. Those are the two most popular supplemental plans to follow original Medicare. And when I talk about the supplement, I like to use the example because I'm a visual person. So if you can visually picture the trucks that are on the highway, like the Amazon Prime, the UPS, the FedEx, the large trucks that have trailers behind them, think of any one of those. Or if you, when you, next time you're on the highway, you're obviously going to see one. Those trucks, think of the truck part, the part in the front, as original Medicare. And then the trailer would be the supplement. So the trailer can't go anywhere that the truck or the tractor doesn't take it. So original Medicare is in place. You can purchase a supplement, and the supplement follows original Medicare. So everywhere that original Medicare is accepted, the supplement is accepted as well. And that's going to pick up that out-of-pocket cost, those deductibles and coinsurance that you would have if you're using original Medicare as your Medicare benefits provider. Now, in addition to that, that piece, those are medical benefits. And if you're taking any of the supplemental plans, you will still have an annual Part B deductible. But after that Part B deductible, you will then be able to continue services with original Medicare paying a benefit and the supplement picking up the difference for covered and approved Medicare expenses. Now, those are the medical. You still need another piece to complete a comprehensive package. And that's Part D, D for David. Part D is your prescription drug benefit. So Part D benefits are offered through insurance carriers as well. Again, you would select the Part D plan that actually fits what you are, what your needs might be, what prescriptions you're taking. Take the time, allow someone to go through it to find out which of the standalone prescription drug plans actually fit you better. When you're choosing the prescription drug plan, you want to choose one that is overall lower cost. So don't look at the one that has the cheapest premium if within the plan you will have those copays that are going to be higher because your drugs aren't covered. So make sure that someone who knows how to actually look for the drugs in the various plans, and in any area, no matter where you are, there are going to be a number of these plans that are available. But that's what that trained, certified person does. They know how to enter the information and find the right plan that will fit what you need. So let me just recap how to use original Medicare. You would use your red, white, and blue card for any of your medical expenses. Purchase a supplement, which can range from $180, $130 to $230, depending on where you are, if you're a smoker, how old you are. So the premiums for that is monthly. You pay that to the insurance company that you select, and then you purchase a prescription drug plan. So you have three pieces that you're using if you're going to use original Medicare, a supplement, and a Part D plan. You have 3 cards. Once that information for the medical is on file, generally they won't ask you except once a year, do you have any changes in your insurance? So you're set. You got 3 cards, 3 different programs, and they're all working in your best interest. Now, I'd like to share with you what the second option is for Medicare benefits. That second option is called a Medicare Advantage plan. And the benefits of Medicare are delivered differently to you. You're going to have one card. You're going to get all of your benefits from one insurance carrier. Now, you're using a private insurance carrier who has an approved plan. It's been approved by CMS in advance of being offered to you. And that plan includes the Part A benefits, the Part B benefits, and most often includes the Part D benefits. Why would you want to use this instead of the backbone of Medicare, Original Medicare? Well, the difference might affect you this way. There is no supplement that you're going to pay a monthly premium for. There's no Part D plan that you're going to pay a monthly premium for, because all of the benefits are rolled into that one plan. And with that one plan, you are actually having the same benefits that you would get through Original Medicare, but through a private insurer that has an approved plan that Medicare says they can offer to you in your area. And Medicare pays the insurance company to give you those benefits instead of paying to the providers. So in essence, Medicare makes one payment to the insurance company that you choose once a month. The insurance company uses their expertise, their statistics that they've gathered over the years for the area that you live in, their network of providers, to actually bill benefits that may be in addition to the ones that you're getting from Original Medicare. So the insurance company now can offer you, they must offer you the benefits of Part A and Part B, but in addition to that, you are also getting, perhaps in some plans, and each plan is different, you're getting vision care, dental care, perhaps you will have fitness, health and wellness, over-the-counter benefits, other benefits that are not typically in Original Medicare. The insurance company then gives you this plan. You will use the card that is provided by the insurance company, and you may or may not have a premium, a monthly premium at all. So think about it in terms of option 1, you use Original Medicare. There's no network per se, because any provider that takes Original Medicare, the tractor, the truck, remember, the supplement that you're paying for monthly will follow that benefit, the Original Medicare. So if the provider takes Original Medicare, they will take the supplement. The second choice is the Medicare Advantage plan. And with the Medicare Advantage plan, you will have one card, one benefit carrier, one insurance company, and you'll use that card for all of your medical benefits, your prescription drug benefits, and those additional benefits that may be offered in your area, and you don't pay a monthly premium because Medicare pays the insurance company to give you that plan. Now, within that plan, you may still have copays and in some instances, coinsurance. You do have an out-of-pocket maximum. So the most that you can spend for medical expenses is capped. Someone who has gone through the Medicare required training annually can sit with you and go through what these different options mean for you, because everyone's situation is different. And when I say everyone's situation is different, even husband and wife, my husband and I do not have the same medical needs. If you do not have the same medical needs, you may not need to have the same plan. Listen to me. You may not need to have the same plan that your sister has, that your husband has, that your wife has, that your golfing buddy has. You need to have the plan that fits you. There are many options available in terms of carriers and how those carriers service their customers. So since Medicare is confusing and it's not getting any easier, my request of you is that you think about asking someone who actually has gone through the CMS required training, through the carrier required training, and is certified to talk to you about all of the options that are available so that you can make sure that you are receiving the benefits that you should. The decision of which carrier, who your doctor should be, which plan works best for you is your decision. It's not my decision. It's not your agent's decision. It's not someone on the phone that you will never see or talk to again. It is your decision. But in order for you to make an informed decision, you need to be informed. So get the real truth, get the real information. And if you have any questions, or if anything is bothering you about what you have now or what you should have, then by all means, contact me. My name is Faye. My number is 407-340-6282. You'll see it all over the social media. And if you don't know how to get in touch with me, just go to my website, fayesaxonhorton.com. I hope that this has been at least enlightening for you, so that you know that everybody who becomes eligible for Medicare has choices. And Medicare wants you to have choices. Medicare does not insist that you have this plan or that plan, and Medicare will never call you to say, you should take this plan or you should take that plan. It's your choice. Know what your choices are, because choices differ in different areas. I'm Faye. I sell Medicare plans. 407-340-6282. Have a blessed and marvelous day.